Let's talk about breast lifts. There are many different ways of doing a breast lift. There are different incisions that you can use. One of them is called a crescent breast lift, which means you just take a little bit of skin right above the areola. Obviously, if you're doing an explant operation, that's really not doing a whole lot to you. It's not really lifting the nipple. It's not making the areola a lot smaller. It's not tightening up any skin. So that really is not a lift that we would use when we're doing an explant. The other is a peri-areolar type of lift that just goes around the areola over here, and it takes some extra skin around here and it tightens that up. The downside to that is, yes, you are making the areola smaller, but you are relying on a stitch to hold it that small. A lot of times that stitch will loosen or it'll fail, and that areola will get a lot wider as well. And again, you're not really doing a whole lot of skin tightening when you're using that lift, so I wouldn't recommend that for an explant operation either. Another operation, another type of breast lift is a vertical breast lift. That's a lollipop. So that goes around the nipple and up and down. That can be done a lot of times for people that don't have big implants in there, right? So if someone is doing a mommy makeover and they've never had an implant before, you could do that lift basically to tighten up some skin and to raise the areola as well. But for an explant operation, when someone's had an implant in there for a long time, it's expanding the breast in multiple directions. It's expanding it forward and side to side. So in my opinion, it needs to be tightened in both those directions. It needs to be tightened this way and this way. So that's why for explant operations, I would generally recommend a wise pattern or an anchor lift. So that goes around the nipple, up and down, and in the crease. I know that seems a little bit more scar heavy, but in my opinion, that's the best way to not only decrease the size of the areola, move it in a higher position, but actually optimize how much tightening you're doing for the breast overall. So that's why I prefer that type of incision. What I tell patients is just understand a breast lift is skin tightening and nipple repositioning. It's not going to add a lot of cleavage to the top part of the breast. So it can't give you a very high, perky breast. That's kind of where the implant shines. It's able to fill the top part of the breast. It's able to give you that high, perky cleavage. Without that, you're going to have this natural ski slope to the top. A little bit of flatness, a little bit of hollowness till it gets your breast tissue, which is usually around the nipple line. That's a normal breast. Every woman on this planet has that. It's just a lot of times people with an implant, they haven't seen that for a long time, so it takes some getting used to. But a lift will not fill that. It's not going to actually recreate what that implant was able to provide at the top. It's mainly for some nipple repositioning and tightening at the bottom part of the breast. And in that way, I really do feel like that anchor type of lift is the best type of lift for people that are taking an implant out to try to tighten it up as much as you possibly can. Now, what some people say is they come in for taking their implants out and they're like, well, how could I not need a lift? You're taking a big implant out. I understand that. I get that. That makes a lot of sense. But for some people, they're actually not going to benefit from a lift. In fact, it may actually make it look worse, right? If the nipple is in a good position and it doesn't need to move up very high and it's not very stretched at the bottom part of the breast over here, well, then a lift is just over tightening. It's tightening up the breast too much, and it's probably changing the shape in something that doesn't look very natural. Also, if someone doesn't have a lot of breast tissue to actually lift, they don't have anything to shape the breast. So if you over tighten it centrally, you're going to flatten it out, and it just doesn't look quite as natural as we'd like it to look. So a lot of people will benefit from a lift. It makes a big difference for a lot of women, but some people, if the nipple's in a pretty good position and it's not very stretched at the bottom, they would be better served from just taking their implants out, from just doing an explant operation, as opposed to trying to do any lift at the same time. It would just create scars without a whole lot of benefit on the cosmetic aspect of it.